Okay. All right. So welcome everybody. So this is the fifth session of the Active Aging Consortium Asia Pacific's webinar on active aging in the time of COVID-19. So today we have three presenters from Malaysia, from India, and from China. And we're going to have an opportunity to have each person, just as we've done with previous presentations, each have 10 minutes to provide a presentation. And then during that time, while they're doing the presentation, you'll have an opportunity to ask questions in the chat room. So go on the bottom of the screen and note what your question is or your comment is. And Catherine will be assisting and capturing those questions. And so when the speaker is finished speaking, she'll have an opportunity to share what those questions were, and the speaker will be able to respond. So then I'll go on to the next speaker and we'll follow the same format. Write your questions down, and then we'll have a chance for the second speaker to also then respond. Likewise for the third speaker. And then we probably have sufficient time at the very end to then add to this any additional questions that you have and have a free-for-all. So this entire time will last approximately 1 hour. That's the plan right now. Okay, so first speaker we'll have will be Dr. Mala from India. And Dr. Mala is internationally and nationally known as a sociologist and gerontologist with a strong interest in health and development. And she's an associate professor at the University of Delhi, one of the colleges there, and has written 5 books. So she has 5 books on aging to her credit. And so we're very pleased with her participation. She's been consulting with the United Nations and other world organizations as well as sitting on some editorial boards for some journals as well. So we're very pleased to have Dr. Mala join us. So Dr. Mala, this will be your turn to do the presentation. And I believe that I have the slides up right now. Hold on just a second for you. Oh,
Thank you, Cullen.
Yes, you're welcome. Wait now just a second. Can you see that?
Yeah, thank you. Yeah, so good morning, everyone. Happy to be part of this webinar and grateful to the organizers, ACAP, for inviting me to share my thoughts on the topic. Can I have the next slide, please?
Sure.
Let me begin with making few general comments before I share few specific examples of initiatives being taken in India to address the issue of bringing about active aging mechanisms in dealing with the COVID-19 situation. I want to start with saying something about the situation in India. We must recognize that India has a heterogeneous older people population. A large proportion are living in rural areas, about 1/3 in poverty conditions. The coronavirus disease pandemic has brought about unprecedented fear and uncertainty. The elderly rely on social connection more than most, and they need it now more than ever. The elderly sometimes need a helping hand. They also often need to have people around them. While isolation may be necessary during the COVID-19 pandemic and vital to keeping higher risk older adults safe, activities and hobbies can help engage seniors and encourage them to have fun and a better quality of life. Next slide, please. Various initiatives are being taken in the country from the different sectors. A very praiseworthy program has been started by think tank Niti Aayog in association with a philanthropic business organization, the Piramal Foundation. The campaign focuses on bringing behavioral changes, improve access to services, provide easy detection and tracking of COVID-19 symptoms. This program, which has been launched in May this year, is called Surakshat Dada Dadi and Nana Nani Abhiyan, meaning to keep safe and secure grandparents, paternal and maternal. It aims at creating awareness about aspects of senior citizens' health, lifestyle, including preventive measures and requisite behavioral changes. The campaign aims to reach over 2.9 million senior citizens in 25 aspirational districts across India. The program has 53,355 volunteers who are working to resolve complaints of older people. Next slide, please. Therefore, the approaches which are being adopted by this program are threefold. One, it supports senior citizens through behavior change. And the program supports the district administration by driving behavior change through family members, Panchayati Raj institutions, teachers, and other community members. Secondly, it supports in the delivery of essential services. So it supports the district administration by enabling response action for access to basic resources such as food and medicines. And thirdly, it supports early tracking of COVID symptoms. The Abhiyan supports district administration by encouraging and motivating senior citizens and their family to do early screening. Next slide, please. Besides the government, various NGOs in India have taken upon themselves to start different activities which can benefit the senior citizens during the COVID time. And besides the NGOs, we also have various medical colleges and other medical establishments working on this issue. The pandemic has made organizations aware of the need for age-friendly programs, and we have Graceful Living Initiative, as well as HelpAge India, a large organization in the country, has started multi-service stay center in the district of Kerala, which is taking out various age-friendly initiatives. Vegetable seeds are being given to beneficiaries of daycare centers. These are being grown by older people. And since this program started 2-3 months back, and now these are being harvested. With this activity, seniors are engaged at their houses. They feel very comfortable being homebound, but being active, and they feel quite positive even during the pandemic. Other virtual activities like yoga, meditation, physical exercises are being encouraged by this NGO, as besides other NGOs. And digital literacy training is also being carried out through online classes in different states, which is something which the older people are much who require it, and are being very appreciative of this, because I had interviews with some of them. Now, it is very interesting that some of these activities are being carried out in rural areas, also in small towns, and not only in big cities. Next slide, please. Now, very progressive initiative has been taken by NGOs in terms of initiating income generation activities for senior citizens, and also doing programs related to enhancing medical facilities. As shown in the slide here, an old lady who's one of the beneficiaries of HelpAge India program in the state of Kerala, which has the largest proportion of older people among the different states, is making home decoration items like many other beneficiaries. And such income generation activities allow the older people earn a decent amount by which they can meet their basic day-to-day household and personal needs. Some such income generation programs are also being supported by government in collaboration with NGOs. What we do find is that some younger people are volunteering and involved with the distribution of medicines to senior citizens who cannot move out of their houses. They also provide medical consultation because they are being trained for this, provide counseling, advice on physio activities, which greatly benefit older people. It is interesting that NGOs are providing videos to guide older people in exercises and other day-to-day activities. So some of these initiatives have become very popular and really being welcomed by senior citizens. Next slide, please. Some NGOs like Silver Inning or Graceful Living and a few others across the country are concentrating on reaching out to poor older people, the migrants, those without jobs. They are doing programs providing health benefits, food, and involving older people in different activities. There are specific programs being done for those affected by dementia. The different chapters of Alzheimer's related Disorder Society of India runs various dementia care centers in different parts of the country to meet special needs of patients and families affected by dementia. For example, what I have shown here in my slide, the Bombay chapter is using social media aggressively to reach out to this segment of the population. They have a campaign which encourages compassion, different opportunities to senior citizens, and appreciates values of the Indian traditions, are starting innovative programs, and they are discovering new joys in living. So this has various dimensions, and it is much being talked about. Next slide, please. So I would now like to share some very recent steps being taken just this week. In the beginning of the week, the Supreme Court directed the states of India and Union territories to file a detailed affidavit within 4 weeks, stipulating measures to ensure that senior citizens who are living alone amidst the COVID pandemic are given proper care. The court had recognized the obligation of the government in taking care and protecting the elderly who live alone by securing the availability of essential goods and services to them. And to this end, the court directed the Union Ministry of Social Justice and Empowerment, which is the nodal ministry to look after older people, to make sure that old age pension continues to be paid on a regular and timely basis, as this is a very important aspect of their lives. The caregivers across old age homes are being provided with necessary safe equipment, and all precautionary measures are being put in place. Next slide, please. So while many initiatives are being taken to face the pandemic, quite obviously some challenges exist. One of them is that safety of seniors is a big concern. Secondly, behavioral change and continuous support is required to help senior citizens adopt to the safety measures of COVID. Thirdly, unfettered access to essential services by senior citizens is limited to people in well-connected areas. And fourthly, the lack of quick action to symptoms makes containment difficult as early detection methods are limited. And another important challenge is that, and that is being overcome by that more of physical distancing is being advocated and not social distancing, as that leads to isolation, loneliness, psychological problems, and other quality of life issues. The last slide, please. So to conclude, I would like to say that various creative ways to keep seniors from falling victim to the risks of isolation, such as loneliness and depression, which would lead to additional health hazards, are being adopted. Then families are being encouraged to communicate online through Skype, Zoom, etc., and also through WhatsApp, mobile chats. And this communication is being much appreciated. Then older people are being encouraged to stay active by exercising, physical mobility within the house, along with various mentally challenging activities and involvement in personal care and hobbies. And also a lot of intergenerational programs are being encouraged and practiced. There is also focus on encouraging seniors to focus on staying busy and maintaining their health through the COVID crisis by being mentally and physically fit. So just to my final word, that we are in control of situation, I would say, and we are quite positive that things are manageable. Thank you very much for your patient hearing. Thank you, Cullen, for doing the slides.
Thank you, Dr. Mala. Yes, so Catherine, are there any questions that has come up or?
No, but everybody says hi. There's lots of things in the chat where everyone says hi, 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 greetings and welcome. So that's really great.
Okay, well, there may be other questions that might come up later, but what's the infection rate in India right now? Any ideas in comparison to other countries?
No, the India rate is quite high compared to other countries, and like it is being said that America is the highest, and second is now India. But what is encouraging is that the mortality rate is not so high. They have been able to control that, so which is an encouraging sign. And also what is being seen is that mortality of senior citizens is also not that high. So we earlier everybody was very concerned that senior citizens would be most affected and they are at greater risk. No doubt they are at a greater risk. But what the figures are showing is that other younger groups are also getting affected. And it's not just totally being concentrated on senior citizens.
Okay, all right. So there may be other questions that will come up. So
yeah, there is one.
Okay.
What's being done to help prevent conflicts between family members that are all stuck in the house together for too long?
Yeah, like I pointed out towards the end of one of the later slides, a lot of intergenerational programs are being carried out. My own NGO, Development Welfare and Research Foundation, we are interacting with senior citizen associations as well as with resident welfare associations and trying to encourage intergenerational bonding by emphasizing that senior citizens are an asset to the families because they provide care when working couples are busy. And secondly, we are also encouraging the working couples, the adult generation, to realize the importance of senior citizens and to look after them. And this together is making a difference because senior citizens are providing their share of activities which help the households to function smoothly. And the younger and the adult generation is trying to look after. I'm not saying that issues of elder abuse and these are not there. They are there, some of them are rising, but a lot of attempt is being made to minimize this and do with programs which can help families to cope and to bear with each other in this lockdown or a situation where most people are indoors and working from home. So the pressures are definitely there, But if we encourage senior citizens as well as the adult population to have a very positive and accommodating, cooperative attitude, and therefore a lot of programs are being done to encourage this. So we send booklets, we send leaflets, and we try to talk, make personal calls to families which are facing distress and which are under strain, so that some kind of counseling and some kind of interactions can help them to have a more positive and accommodating attitude.
Okay.
All we need to
Mala,
is
Mala,
do. Thank you.
there's going to be there's some other questions directed to you, and I'm going to direct you to the chat since we're probably out of time. But you should look in the chat because there's some very interesting questions for you to respond
Okay,
to.
okay,
Okay.
thank you,
Okay,
Catherine. Thank
so
you.
we'll come back at the very end, assuming we have enough time. Yeah, so let's go on to Dr. Rahima. So Dr. Rahima is from Malaysia, and she's the Deputy Director of the Malaysian Research Institute on Aging at the University of Putra, Malaysia. She's also Associate Professor of the Department of Human Development and Family Studies. And so she's been lecturing in this area of aging, as far as the psychological aspects of aging for quite some time, and is on the executive committee of the Gerontological Association of Malaysia. So we have here someone, of course, that has a lot of work done in this particular area. So thank you so much, Dr. Rahima. It's all yours now.
Thank you, Cullen.
Yes.
Hello, everyone. I'm Rahima from Malaysia, and I'll be sharing with you some innovative ways that we are dealing with the pandemic in Malaysia with regards to active aging. Let me pull up my slides. Oops, doesn't show.
There we go.
Okay. So my presentation will cover these four topics, but basically it's focusing on two innovative activity. The first one is going green at home and in the community, and also going green online. And at the end of my presentation, I will wrap up with some lessons learned from the COVID-19 experience in terms of active aging. So when Malaysia confirmed its first case of COVID-19 in the community on March this year, it was followed by a movement control order that prohibited people from going out of their home. I mean, we couldn't go out at all from our homes and have to do most of the things online. This has severely affected older persons, and many were isolated at home. Having more time to spend at home means that older persons have to adapt their daily routine and rely on telecommunications to keep in touch with family and friends. Due to the loss of activities and access to usual care from family or formal providers, it is quite challenging for older persons to maintain their health, and at the same time to prevent from being infected by going out in the public. Because of health vulnerabilities of the older persons, our Ministry of Health have also advised against older persons going out in the public to reduce the risk of infection. Starting June, Malaysia has gone into the phase of recovery movement control order, allowing traveling within the national borders. Gatherings were subjected to specific procedures, including temperature checking, physical distancing, and using the app for contact tracing. Okay. So gardening is a popular activity during the movement control order as people are restricted to their own home. seeds and gardening tools were selling like hotcakes, and people start to exchange seeds, plants, and produce with their neighbors or through the mail. Our postal workers were working around the clock and facing huge pile of deliveries during the lockdown. Here is a case of Puan Mazna, who had performed brachytherapy and several chemo sessions end of last year. She lives with her husband and her children frequently visits her. Due to the movement control order, family visitations were halted and becoming less regular. The daughter saw her condition was deteriorating due to the isolation and decided to set up a home garden so that her mom can see the plants from her balcony. The vegetation also helped her to keep active. Her next door neighbor, who is also a cancer survivor, exchanged plants or herbs with her. The daughter has selected plants that her mom used to love, and she reminisced about the plants that she used to have in her kampung or village in Terengganu. Now, we are talking about people becoming more restricted indoors, and there's a program for urban agriculture, yeah, developing community gardens around the local area. So urban agriculture is a program under the Ministry of Agriculture and Food Industries through the Department of Agriculture that targets 800 communities and 12,000 new individual applications. This is a part of the short-term economic recovery plan or PENJANA to help lower income communities to set up community gardens. So yeah, the program provides assistance in the form of agriculture input such as seeds, fertilizers, infrastructure, equipment, technical advice, and training to individuals up to 500 ringgit and communities up to 50,000 ringgit. Many local councils have established their own community gardens through the urban agriculture program. And I bring here the case of Putrajaya Community Garden as a case example for sharing. So the community garden in Putrajaya has created a solidarity among the members. Yeah. It was started by 7 community activists who are avid gardeners and agriculture science hobbyists. That's what they told me. All members are 60 and above. The project hones different niche of each group member, and they have individual plots at home, in the residence home, and also community plots beside the apartment or high-rise area in the precinct of Putrajaya. Members continue to perform activities amidst the physical distancing. And it has been gazetted by the Putrajaya holding as their community garden. So the man in the picture is Pak Ngah. He has been telling me all sorts of projects that he has been doing with the community members. And since then, many more have jumped on the green bandwagon. Yeah? And they have started new projects in the different precinct areas. And members have aquaponics or stingless beekeeping in their bungalow unit or other agriculture related projects. This project involves collaboration between universities such as the Multimedia University and also the older persons communities such as the Putrajaya Senior Citizens Activity Center. So you can see these are the plants that they plant in their community gardens. We have jackfruit, rambutans, and some ornamental plants. So this takes us to going to be able to share your gardening experience online.
Lenora, bring her.
Most older
Join
persons,
the meeting.
Most older persons share their experiences through WhatsApp, yeah, or also Facebook. But we we realized that there are differential access and uptake of technology among older persons, and the knowledge of and use of social media among older persons are still developing. Therefore, it is important for these urban agriculture initiatives for older adults to consider technological component, because there is a aspects of knowledge transfer, online business, and also communities. The 15 Minutes Farmer is a Facebook group that you can check online. And there's also the Urban Farm Malaysia, which is the first urban aquaponics farm in Klang Valley, Malaysia. Bengkel Technology Senior is a program, is a 3-year program from 2019 to 2021 to boost digital literacy among seniors aged 55 and above. So they have a series of workshops. This is a collaboration between universities and the private sector, namely the telecommunication sector and also the some private companies. So what are the lessons learned from this pandemic challenge is that being active, it can be challenging for older adults, but going green and going online can keep older adults active while being subjected to physical distancing. It is important to remember the heterogeneity and varying needs of older adults in designing activities or programs, because 60% of older Malaysians have the potential to contribute to family and community. So we should not think so much. I mean, there are a lot of programs, especially assistance during the pandemic, but we should not neglect those who are able to contribute to the family and community. This is our home gardening series that is starting in September 2020. We are applying physical distancing and infection control standard operating procedures to run these courses. And we can only do it in limited or small group sessions. We are also collaborating with the non-governmental organizations and also the private sector. And this will also be our research pilots for our researchers at the Institute. Thank you very much for your attention.
Okay, thank you so much. Yes, this whole idea of gardening is wonderful. I've got involved with gardening, but I've tried trying to grow pineapple, but I don't recommend growing pineapple. It takes a whole year just to grow one, so don't do that. But let's see. So, Catherine, maybe
yes,
we could
yes,
entertain
there's
one or
several
two questions.
There's several questions related to the gardening project. One is, who donates the farmland? Who's donating the farmland for this?
This is a part of the residential area, so they have a unused land next to the residential area. So they did their community gardens in that area. So they have to apply through the local council.
Oh, I see. I see. And then there's a question about the risk of contracting COVID if you're involved in outdoor gardening.
Generally, it's not a group activity, not a large group activity. So 1 or 2 people in doing gardening at a time. So there's physical distancing, and also they are aware of the general precaution that is being applied in the community.
Okay.
That's a good question. Yeah. We have community gardens here in Hawaii, but our city government decided to close all of the community garden parks that was provided by the government. And so seniors are very, very upset and sad. But you know, so maybe we need to change our policy there. But anyway, thank you for your information and the information about gardening. Yes. Okay, so let's consider our third speaker.
Rahima, there are some more questions in the chat for you that you might want to look at.
All right.
Yeah, take a look at those because we may be able to have enough time to circle back. Okay, so our third speaker is Dr. Du Peng, who is Vice President of Renmin University of China and also the Director and Professor of the Institute of Gerontology at Renmin University. He's also Vice President of the China Gerontology and Geriatric Society, Vice President of the China Population Association, has done a lot of research in population aging and aging policies, and of course done a lot of publications as well. So again, we have another very famous and very productive person in China doing work in gerontology. So we have him again talking about the situation in China. So Dr. Du Peng, it's all yours.
Yeah, thank you, Chair. I will share my screen.
Yes.
Yeah. Do you see it?
We can see it. Great.
Okay. So thank you, and great to share the experience and the lessons among the scholars. So I will focus on the active aging in the time of COVID-19 based on China experience. In fact, the problem when we had the COVID-19, it was very special time. I want to introduce the three special points for that. First is in January, quite possible for the elderly to have a fever. So by that time, it was very difficult to recognize it's a COVID-19 or fever. So that's the first challenge. The second, because of it's just before the Spring Festival, so many of the residents in the nursing homes, they were brought back to their home. And some rare to stay at the nursing homes. But then suddenly with the COVID-19, so you have to decide whether you keep your elderly at home or send them back to the nursing homes. So that's a challenge for many families. The third, because of the Spring Festival, all of the family helpers, they went back to their hometown. And usually for those that 1 week, the family members will take care of the old persons, but they didn't know it's such a long time after the COVID-19. So based on that, we can see the knowledge old adults, they are more likely to have dire outcome from the COVID. And also we see the lack of the care and the social isolation among older adults were fully exposed in the epidemic because family members, they couldn't sustain the care for the old people for more than 1 week or by now if maybe 6 months or 7 months. So on the other hand, the nursing homes, their staff, they couldn't come into the nursing homes. Otherwise, they had to stay in the nursing homes. They couldn't go out. So that's the difficult part. And the most difficult part was if the elderly, they need to see the doctor in hospital. If they went to the hospital, they couldn't come back. They have to be isolated for 14 days. So that's a challenge for the medical system. And then the last challenge is on the active aging practices. What are the roles of these old people, the seniors in the communities or families, and how the society, they are common to see these old people. And then the integrated health and social care. are the top priority for the challenge, because even for the elderly, they need to see the doctor. They couldn't come out. And for those old people, every month they can prescribe their drugs. Now they couldn't go to the hospital. So the improvements for the society is to develop the telemedicine. So it's very popular in China now to have the telemedicine. You don't need to come to the hospital, and then they can prescribe the drugs. And then the second, to extend the drug prescription from 1 month to 3 months. So so that the old people, they do not need to see the doctor once a month. So that's some changes to cope that, but still it exposes the nursing homes, if they can't provide the daily care, especially some medical part, that's a problem for the elderly in the hospitals. And from hospital side, in fact, for chronic diseases, whether we need to give just a 1 month prescription for the drugs. So both sides consider to reform the current system. On the other, another point is it's necessary to strengthen family doctor services and develop telemedicine to solve those problems. For family members, if to see the doctor is risky, but their family members, they have to go to the hospital to describe the symptoms of the old parents and to get the drugs, and then to send the medicine to the nursing homes. So how to, if we have some medical family doctors, they can visit the elderly in the nursing homes or in the communities. That can really help. So especially in rural areas, that's another challenge. Then as the previous two presentations mentioned, digital divide is prominent. We assumed that everyone they are accessible to the internet and the mobile phones. If you, even nowadays, if you go out of the communities, you go to the hospital, you have to show the mobile phones some codes on internet mode to identify you are healthy, you don't have a fever. But for many old people, they never use mobile phones, or every city, in fact, they have their unique way to show that. So even for myself, I visited another city. It took me about 25 minutes to find the way to show the local code for the travel. So for many old people, I had several interviews during the past 6 months. I commented that we developed maybe too fast. Many old people, they can't follow that, not just for COVID-19, but also for if you visit my museums or maybe some places, they never have a ticket office now. You have to log in the internet to get the digital tickets for that. But for many old people, that may be a challenge for them. They can't do that independently. And with that, although young people, they can keep their daily life, they order their goods, what they need, the vegetables, the goods online. But for many old people, it's difficult for them. And the old people, they are in the communities or in the nursing homes because the communities or nursing homes have some restrictions to allow the people to visit. So psychological problem is obvious. So even for their family members, if they can't visit the parents in the nursing homes or in the communities for several months, the depression or loneliness is a new challenge. I showed a picture here. some APP help the old man to talk with the children online. But for some old people, if they have health problem, they want to talk more, to have more interaction with their children. Still, it's not a popular way to do that. So that's for mental health. And for old people, they may have loneliness, anxiety, and fear during the pandemic. Mental health programs should be recognized as an important component of elderly service. We realized that, especially during the COVID-19 period. And then now the current policy is, in fact, we assume that the campus, almost 1 million students came back to campus even for universities in Beijing. But then they use word normalization to see we need to check the health code to keep the current restriction policy maybe for a long time, especially we are entering the autumn and then winter. We still have a problem to recognize the fever and COVID-19. So in that background, we need to re-examine the existing system and the capacity of active aging, how to strengthen that. One experience is we must speed up the long-term care services system. The national policy will be announced to have more pilot cities to strengthen that, so that to provide healthy aging, not just for the old people with disability, but how to provide services in the communities in their middle age or maybe early stage of old age, and how to strengthen the family caregivers to help them to have the knowledge and access in the communities to get the help for their family members. And then for active aging, it's necessary to encourage the social participation of older adults. Even during the COVID-19, we have some very good examples, but for the majority, the most important part is how to deliver the long-term care service so that those people need help. They have they can be supported. That's the most important part. Based on that, and how to stimulate the participation of social organization and also the home and community-based care services. I show some pictures for the healthy aging. We have some brochures to inform the elderly what's the COVID-19 and what's the safely if they stay in the nursing home or at their home in the communities. So the old people, they don't need to worry about that. And even for the nursing homes, how to prevent the virus and how to keep the nursing homes safe. That's for the staff. The left part is for the elderly and their family members. So both are very useful. For active aging, one important phenomenon is when you don't have the reliable information resources, who do you want to believe? So, and then I give 3 examples. They are the most famous person, and they are all senior persons. The left one, who is 84 years old, just got the national award several days ago, who was a doctor in Guangzhou, close to Hong Kong. And 17 years ago, who was famous during the SARS. And now, 17 years later, who was the first person to recognize, announced we need to, it's so infectious of the COVID-19, so we need to have the face mask. We need to have social distance. That's from this person. So that's why he got the national award earlier this week. And then the second one is the president of Tianjin Chinese Medicine University, and the right side is the lady who is also the leading doctor in Wuhan. So these people, they also enable the whole society to recognize the leading role of these senior doctors, these senior persons. And for the ordinary old people, I show some pictures in the city and also in the villages. They participate as volunteers in the communities to keep the community, to track the hygiene measures and to keep the society safer. So they, in fact, in many ways, they joined the combat to the COVID-19. Now we are doing a project to summarize the experience and lessons. It's a project by UNFPA and the Public Health Authority. So I hope in the future we have a more chance to share the information, not just experience, but also how to improve. We found the difficult parts during the COVID for old people. So how to improve our services in the near future. So that's my presentation. Thank you for your attention. Thanks.
Thank you, Dr. Dufeng. It's very, very wonderful and very insightful. Yeah, this point about the older people do not have to just be looked at as being the receivers of services, but also the contributors of services to the larger society. And we have many role models out there, and we should showcase them and celebrate that their good work. Catherine, are there questions? We have a few more minutes.
A number of questions. Two of the questions have to do with mental health. Who identifies when an older person has a mental health condition? And what is China doing in helping elderly with mental health problems?
Okay. So in fact, we have some study to show maybe during for after 1 month or 2 months, some more old persons, they may felt lonely or depression because they couldn't see their children or family members. So that's a challenge. So, and then with the development of the control, and then the government, especially the authority in charge of the nursing homes, released the restriction to create some space to enable them to see each other, but not in a social distance. So that's one way. And the other way is to use the WeChat, some online to see and talk on mobile phone, so that they can talk and to see the situation. So that's some measures for that.
Yeah, and that relates to another question about government programs to make sure every elderly has a smartphone. Is there a program like that?
Yeah, in fact, according to the report about mobile phone last year or internet users last year, less than half of old people, they have smartphone. So in the current APP to track the health status, they have some choice you can identify that for your family members, especially senior members, so that the elderly, they don't need to have their mobile phone, but their family members can input their ID and to help them to show the situation.
Okay. Well, we have a few more minutes. Would there be any others that anybody else that wanted to comment or any specific questions? You can unmute yourself and say something at this point with regards to all of these presenters or one of them. Anything in particular? as Catherine has mentioned, there are a bunch of other questions that are directed to each of the speakers directly. If the speakers can respond to them, that would be great. What we would also like to do is encourage communication as much as possible, right? So that we can share with each other, learn each other's email addresses, for example, and just share with each other. This is all very important. Catherine, do you want to share a little bit about the next session?
Yes, I'm trying to unmute everyone, but you might have to unmute yourself if you want to say something.
I'd like to ask a question.
Yes, I'll just say that our next session in 2 weeks focuses, continues Dr. Dupeng's conversation about what's happening in long-term care and residential facilities. And we'll have speakers from Hong Kong, Japan, and the US. I'll send out a flyer. I think you have some questions, Cullen.
Okay, go ahead. Who's
Brian?
Hello.
Yes, go ahead, Brian.
I want to ask a question of the speakers about reactions from the public to contact tracing and the use of an app for that purpose. Has there been any resistance from the public, the general public, to the compulsory, what might be the compulsory use of an app for contact tracing?
I guess the question is directed to me, Brian.
So yeah, any of you, because I'm just saying, I guess in a more liberal democracy, there are a number of people who resist the use of an app for contact tracing. They have the option of signing in when they go into a shop or something like that, but they just resisting the use of an app, which is seen as if you like, a surveillance mechanism of the government. So I'm not sure whether this is an issue for any of the speakers today.
It is mandatory in Malaysia, so anyone who is non-compliant will be fined, and the premises that did not enforce the contact tracing measures can also be fined. There are, of course, after 6 months of the movement control order, people started to, get relaxed a bit about the requirements. But since the cases have also increased yesterday, the Ministry of Health will still require us to do this contact tracing if we go out to any public areas or any commercial premises.
Okay.
Yeah, I will, in addition to that, I will say some words. So in fact, at the beginning, people didn't feel that, convenient because, but you have to balance the safety, the health, and the privacy. So nowadays, we have to keep every shop, you need to show the health status with the APP. But if you're not, you don't require that. Some citizens, they will ask for that. They said, okay, it's not a safe place. So we experienced the change of that at the beginning. It was not convenient because people think whether the privacy can be kept. But with the experience, people think it's safer. And also now with no cases for COVID-19, people may thought that it was worse to sacrifice some privacy of that. Thank you.
Yeah, I would also like to add here, in India too, we have an app. The government has prescribed it for every citizen to download it so that contact tracing can be done. And a lot of places require it before you enter. Airports, banks, shopping centers, the big ones, not the smaller, neighborhood shops, but big malls and all. You have to have that app downloaded on your phone to be able to access services later. And a lot of people, of course, like Dupeng said, initially had hesitation because they thought it's an app which can take away a lot of their data, personal data, but gradually people are using it because they find it beneficial because it provides access to services and to facilities, and as well as it can contact trace anybody affected by COVID. So the practice is catching on. Thank you.
Yeah.
Dr. Dupeng, this is Thelma Kay here. Can you hear me? Yeah, hi. In Singapore, our community-based elderly services were sort of shut down for quite a long time during the lockdown period. But now they're beginning to open because our elderly really miss those services. And many of them, as you say, feel very isolated at home and lose their connections. But then how do you balance the safety concerns? Now they're beginning to open up. How do you balance these safety concerns with the need to connect and participate? I guess in China, you have opened up. So how do you do that? Thank you.
Thank you for the question. In fact, now it's open as usual. So nowadays, no problem. Family members can visit, and they can send seniors to be the resident there. And also the nursing home residents, they can come out now to go back to their home or to see the doctor. But in the past 6 months, it was really a challenge. Especially they have the most restricted policy for the nursing homes. With the background, they thought the old people, they are most vulnerable group. So many discussion about that, whether we need to be so strict, but the government policy is to keep the most safe place as the nursing homes. We do have some sacrifice to balance that, because some old people, they cannot come and with to register in the nursing homes. But with the improvement of the control, and then gradually they allow the seniors to move in, but they have some special section for that to keep them for 2 weeks to see whether they have been affected. So they had some additional procedure for that, and then to overcome the difficulties. But with that, also they try to send the home services from the nursing homes to deliver the services to the old people. Time to establish the new order, the new system. But the most difficult part was the Spring Festival period, because no staff of the nursing home can do that. Yeah, so that's what we experienced.
I wanted to ask Dr. Thomas Kwan wanted to say something.
Thank you so much. I just want to mention that in Singapore, I think in Malaysia, in most other countries, citizens are given some sort of small amount of cash money in their account to tie that.
We can't hear you, Thomas, but I think your question is about, are citizens given any cash to stay indoors? Is that your question?
Yes, you can't hear me. Oh, sorry. Yeah, that's the question I asked. Yeah.
Are citizens given any cash to stay indoors?
Right.
Rahima?
Yeah, right.
Are people given cash? Dupeng? Mala?
Unmute first.
We don't have that. Yeah.
No, that
we don't have
practice is not there in India. It's just made to be voluntary, and it's just an advice which is given, but no cash is being transferred.
Fahima?
Okay.
I think there are financial assistance for those who need help, but for those who are taking up gardening, there will be some financial assistance for individuals and communities.
Yeah, we don't have that the cash support for generally we don't have that, but for some poor elderly, they really have this kind of difficulties. They have some subsidies for that, but it's not a cash policy generally.
Yeah, even in India, for the very poor, the government is giving them rations, food essentials, a minimum amount, which can help them to sustain a survival of their, and for those who are without jobs, there are some government schemes which are, but the major effort at present is to get people back into the economy and help them to sustain themselves through work activities and not just emphasize more on dole giving or, you know, that kind of subsidies. So, and the government is making efforts to open up the economy gradually and provide work opportunities. Thank you.
Okay. I'm sure that there's many more questions. We've sort of run out of time, but we've had 40 of you participate today, and that's wonderful. And we've made so many new friends from China, from France even. Moira from France is joining us very late at night there, so or in the morning. Right? So thank you so much from all over the world, and we've made new friends. And you know, please continue to interact and share with each other, and let's continue to keep doing what we're doing. So thank you so much. And then again, as Catherine has said, we're going to have another one in 2 weeks. So please join us at that time. Okay. So thank you very much.
Okay,
bye, everybody.
Bye-bye.
Bye.
Bye.
Thank
you. Bye.
Bye.
Bye, everybody. Thanks for
Yeah, thank you very much. Appreciate this
It was
effort
a wonderful session.
getting
Thank you so
everybody
much.
together.
Thank you.
Bye-bye. Thank you very much. Bye.
Enjoyed the session. Bye,
Teresa.
everyone.
Bye. Good health. Good
Bye,
health.
Katie.
Bye,
Bye.
everyone.
Bye.
Bye, Ed. Bye. Bye-bye. Thanks.
Bye-bye. Yeah.
Okay.
Good.
All right. This was great. All right.
Bye, Thomas.
Okay, I'm going to end it now.
I will see you. Bye-bye, Catherine.
Bye,
Thank you so much.
everybody. Take care.